So I am going to give you a simple formula. You may want to memorize this one so you can impress all your Spanish-speaking colleagues, because I bet you even they don't know it. Now this question can be used right after you introduce yourself, or I'm going to give you only the ones that you need. Okay, so in today's lesson, we're diving into the essential skill of symptom assessment for nurses and doctors. I aim to teach you both about symptoms and how to ask about them. Before we dive into the specifics of symptom assessment, let's break down the anatomy of asking about symptoms in Spanish. This will help you understand the structure of the questions and how to construct them effectively. Here's how you ask about the symptoms. So let's start with the basic question. ¿Qué siente en este momento? Which is, what are you feeling in this moment? Now, let's look at the anatomy of this question. ¿Qué? What? This is the question word, indicating that we are asking for information about something. Siente, which is feel. This is the verb, indicating the action, feeling in this case. And in, this preposition is used to indicate the time frame or context of the feeling. Este, this, is the adjective specifying the moment or time frame. And momento, this is the noun specifying the time frame or context of the feeling. Altogether, we have ¿Qué siente en este momento? Now, this question can be used right after you introduce yourself, or even after you've been talking with the patient for a while, to get to the bottom of it. You know that question, the typical yes, but right now, what are you feeling? En este momento, ¿qué siente? If you don't like that one, here are other options for you. ¿Cuáles son sus síntomas? What are your symptoms? ¿Qué síntomas tiene? What symptoms do you have? Or just keep it short. ¿Qué tiene? Which is a loose translation of what's wrong. So now that we know how to ask about symptoms, we can learn how to formulate specific questions for different symptoms commonly encountered in a medical setting. So I am going to give you a simple formula. Siente blank. And that blank can be filled by literally every symptom you can name of. Very simple and very straightforward. So if it's pain, you can ask siente dolor. If it's numbness, you can ask siente entumecimiento, and the list goes on. So let's practice with some common symptoms. Siente fiebre, do you feel fever? Siente fatiga, do you feel fatigue? And I am actually going to give you guys some flashcards, link in the description below. Now let's get specific. Let's talk about areas and body parts. This is very, very important. When asking the patient if they feel pain in a specific area, you can ask it like this. Siente dolor en algún lugar específico. And we can look at the anatomy of this question as well. Let's break it down for you. Siente, feel, a verb again, indicating the action, feeling. Dolor, in this case, is just pain. It's a noun specifying the sensation being felt, which is pain. And in, the preposition is used to indicate the location or area where the feeling is occurring. Algún, some, or any, depending on the context. This is an indefinite adjective used to express some or any in this context. Lugar, place. This is the noun specifying the area or location. Específico, this adjective modifies lugar and indicates that we're asking about a particular or specific place. And when you put it all together, siente dolor en algún lugar específico, which translates to, do you feel pain in any specific place? And well, this is where knowing the body parts comes in handy.
Let's keep it short. I am going to give you only the ones that you need.
We have cabeza, cuello, espalda, hombro, brazos, codo, antebrazo, which is forearm. You may want to memorize this one so you can impress all your Spanish-speaking colleagues, because I bet you even they don't know it. Antebrazo is a commonly missed one. Muñeca, mano, dedos, pecho, senos, abdomen, cadera, which is hip, and piernas. Now, piernas, I gotta dedicate some time to this one. Let's check it out. Now, many patients say pie when they mean leg actually. So memorize this question. ¿Le duele el pie o la pierna? Which translates to, does your foot or leg hurt? And the reason why you say this is because when you start to speak more Spanish to your patients, you'll often find that many of them use leg and foot interchangeably for some reason, which I don't know why. So it's very important to clarify that. Does your entire leg hurt or just your foot? Let's keep going though. We have rodilla, pantorrilla, and pantorrilla is the calf area. You'll often come across chamorro, which is a colloquialism for calf area. Also tobillo, pie, and dedos de los pies. Again, I have flashcards. I'll leave a link down there. And that's it for now. That concludes our very short symptom assessment and body parts in Spanish. Hope it's helpful. Let me know what else I should do.